Dr. Stewart, Timonian Foot and Ankle Center. I'm here with our patient, Michael. Michael, thanks for joining us. Michael is coming in today. We're going to talk about his right foot, but he is coming in for his 2-week follow-up for his ankle and his calf. We did some surgery, but we also did a very similar surgery. So I want Michael to just share an experience for people who need to undergo ankle surgery. Michael injured his left ankle previously, and we did extensive conservative care. Most ankles injuries, sprains, I would say the majority of them actually do get better with conservative care. Michael knows we exhausted conservative care, and we really got him better on this ankle. We did a calf release because he has a lot of tightness in his calf. You can barely even see the scar here. We did an ankle surgery. We repaired his ligament here. We repaired his peroneal tendons. He recovered very, very, very quickly on this. Like, how quickly? You were back on your feet.
Yeah, I was walking about 5 weeks after, and I was totally done physical therapy at 6 months.
Okay,
exactly.
So that's usually the timeline we tell people. The bigger thing though is his pain was dramatically down at basically the first post-op visit.
Yes.
He had a tremendous amount of pain. He's now coming in, we did the other ankle because during the recovery on the left side, he managed to injure the right side. We did the same extensive conservative care, about 3 months of conservative care. I just took his staples out of his ankle. We have repaired this ligament. I'm going to scoot around here and you'll come over my shoulder. You can see this. You can see this other incision on his calf. He had a very tight calf. Now we can get his foot all the way up to past 90 degrees. Before he kind of stopped right there. His calf was very tight. How's that feel?
Very good.
Good, very good. And we're going to show, just very gently stress this ankle. The ankle's very stable. So I'm rocking this. Before, when I rocked it, his foot basically went under his leg, and now he's got a very stable ankle complex. He's got a rollabout. He just came out of a cast. We're going to put him in his boot. We're going to get him started in non-weight-bearing physical therapy. The key is to get these ankles moving as soon as possible. There's a fine line between moving too much and moving too little. We're going to try to reduce scar tissue by getting him doing some formal physical therapy, which will help with mobility. He already said to me this morning, he's like, wow, my ankle feels super stable.
Yep.
You can feel the improvement.
Oh, yes.
Okay, so just for anybody that needs to undergo ankle surgery, we just want to show an example of how these can recover very well. You can see his ankle is not swollen. His other ankle is very stable, equally as stable as this. And most patients, by the first postoperative visit or within the first 2 to 3 weeks, their pain is pretty minimal. The other thing, last thing I just want to point out, when I did this surgery, these surgeries usually take us about an hour to an hour and a half at the most. This took an extra 15 minutes because he had this massive vein right here. And I'm actually extremely happy to see that his swelling is very minimal. So 2 weeks out, his swelling is a lot less actually than it was before we did the operation. This is because we had him icing, we had him elevating, and he was a very good compliant patient. Michael's going to start some physical therapy. If you have any questions about ankle injuries or other foot or ankle problems, feel free to give us a call at at 410-560-2777 or visit our website at www.timonianfootandankle.com. Thanks. Bye.